The most common referrals will be people that are concerned about allergies, so allergic rhinitis or the nasal itching and the nasal congestion, allergic conjunctivitis or eye symptoms related to allergies, hives or the red raised bumps that may be caused by something in the environment or may not be, anaphylaxis or severe allergic reaction to either bee stings or other unknown causes we evaluate for. Recurrent infections being pneumonia, sinus infections. If someone's concerned that they may have an immune problem, we're familiar with the testing that may need to be done for that. Drug allergies, atopic dermatitis, eczema, and contact dermatitis are a few of the skin conditions that we also see, which are often these red, scaly conditions that may itch, that there's certain treatments that we're able to provide. The classic food allergy, the reaction often will show up on the skin. That's the most common reaction that you'll see. The more severe reactions may cause problems with wheezing, asthma-like symptoms where there's shorter breath. You can have some throat thickening or even constriction of the throat. The others symptoms can be GI symptoms or gastrointestinal, which involve nausea, vomiting, diarrhea. As it progresses, people can even have something called anaphylaxis, where your blood pressure actually goes low and people may faint, and it can be life-threatening. So the reaction can involve all spectrums, the most common being skin, and then from there other body systems can get involved. So one thing that would happen if you came to our office and saw me is that you can do skin testing, and what that is a small plastic device that just gently pricks the skin and allows the allergen to get underneath the skin and expose to the cells. Sometimes, if the skin tests are negative and the history is very convincing, we'll go ahead and do other forms of allergy testing, which may include a needle injection similar to a TB test. It'll be just placed underneath the skin, and a similar wait time will be 15 minutes. The only other test that we will do is a control, so we want to do a negative control, making sure that the test is working, that shouldn't react. Some people's skin reacts to anything that pricks them, so that's what the negative control is for. And then a histamine control, and everyone should react to histamine. If it doesn't come up, that person may need the other form of testing, which includes blood testing. And you can actually get a blood sample, and you're looking for an antibody to what you may be allergic to. Depending on what seems to be the most problematic for them, the medications may be different. So if their eyes are the most bothersome, we can direct the medications to the eyes, so you just use eye drops. If it's more the congestion or sneezing, antihistamines, sometimes over-the-counter antihistamines such as Claritin or Zyrtec, some sedating such as Benadryl work quite well, and then there's also some prescription medications that work well. If it's more the nose, and primarily the nose, or if it's all of these, the nasal steroids are often used and seem to be one of the most effective medications, which is also a prescription. Besides just nasal steroids, there's nasal antihistamines, and there's also something called neti pot or nasal saline irrigation, which is actually a rinsing of the nose with saline water, which helps remove pollens and mucus from the nose. And a lot of people, once they get past that initial stage of using it for the first time, really get a lot of benefit with the nasal saline irrigation. For any patient that comes into my office, I like to make sure I have the time and the ability to listen to the patient to make sure I understand the problem that they come to me for. And then once we determine what the diagnosis is to keep the patient engaged and try to determine what is the treatment that is going to be best for that patient. I really enjoy seeing patients and getting to know them.